Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Chandler Walsh. Today, we'll continue our conversation on vaping and the serious conditions it can cause. What are the most severe consequences of vaping?
Sometimes something that starts out as a simple cough progresses to shortness of breath or severe chest pain that seems progressive and very severe. This is a sign that there may be significant, even life-threatening lung damage occurring, and it's the sort of thing that we want to have you in the hospital so that we can treat you and give you the treatment that you need if you're having these kinds of symptoms. These symptoms are dangerous, and almost every state in the United States we've lost a life due to not recognizing that the vaping-related lung disease can be progressive.
How is vaping damage diagnosed by physicians?
There are really two things. It starts with a history of being exposed to vaping products. It's followed by symptoms that could be related and confirmation that those symptoms aren't due to other known diseases like an infection or some other process. The third step is really to get a chest x-ray to see if there is evidence of lung damage. And the fourth step is to check the oxygen level, usually with a finger oximeter, to see whether the oxygen level has been affected. With those four pieces of information, we know exactly the right treatment plan.
How is advanced vaping damage treated?
It really depends whether your oxygen level is normal or whether it's low. If the oxygen level is normal and the x-ray is abnormal, the trick is to determine whether it was the vaping or some other problem like an inflammatory disease or more commonly an infection that's caused the x-ray to be abnormal. If it's suspected that it's vaping, sometimes advanced diagnostics can be helpful to really nail it down. Cornerstone of treatment is to limit exposure. So the first thing to do is really to discontinue exposure to vaping and vaping products. But people with low oxygen levels, they need to have supplemental oxygen, and sometimes they need to be on a breathing device to help them with their work of breathing. That requires an advanced assessment and should really be done in the hospital.
Is the damage to the lungs and gastrointestinal system permanent?
We expect, particularly the GI symptoms, to be transient and to resolve on their own. The lung damage is expected to resolve on its own, but one of the things we're committed to is following the lung function and the radiograph until it's completely normal. And that can take several weeks, sometimes even months. Keeping track of what you're putting in your body, using your cell phone to record the different substances that you're vaping, the dates that you're vaping, any receipts you might have for obtaining the products, where you got it from, it really helps your doctors understand better what your level of exposure is. And also the device you're using and how you're using it. Those affect the size of the particles and the overall exposure. Those factors help your doctors to understand what your exposure was. And if you've been exposed to an adulterant or a particularly provocative chemical, it helps our Department of Health officials figure out what it is you might have been exposed to, because they can sometimes get samples of the vaping solutions from the manufacturers.
Why does it seem like severe vaping illnesses are on the rise?
We know from our colleagues in the Centers for Disease Control in Atlanta that more cases started being recognized in April. And there's really two theories. One theory is that this has been going on and people had just expected that it wasn't related to vaping, and now we're recognizing it more. Or it may be that there are particular chemicals in the vaping solutions that are particularly irritating to the lung. One of the candidates are vitamin E and its like substances that can sometimes be used to prepare solutions for vaping. And it's particularly important to avoid any products that might have vitamin E in them.